Good morning. I'm sorry I'm late today. It's on this lovely first day of June. I will give our update on COVID-19 here in P.E.I. in Canada, and also discuss the vaccine rollout and long-term care and community care vaccine rates and the reopening plan. There are no new cases to report of COVID-19 in P.E.I. today. We currently have 4 active cases and a total of 204 cases since the pandemic began. There is good news about the third wave of COVID-19 in Canada. Cases are down 34% in the past week, with an average of 3,165 cases per day. The variants of concern continue to increase rapidly in Canada, with over 206,000 cases. In P.E.I., we've had 26 cases of B.1.1.7, which was first identified in the United Kingdom, and 2 cases of the B.1.6.1.7, first identified in India. Also good news in Canada in the last week, with hospitalizations down 16%, ICU admissions down 10%, and deaths down 5%. It is clear that we are heading in the right direction as a country, and that steps taken in many jurisdictions to interrupt the chain of transmission appear to be working. In Atlantic Canada, there have been 999 new cases and 15 deaths in the past 2 weeks. Currently, there are 710 active cases in the region. We've reported between 1 and 16 cases in P.E.I. for the past 15 consecutive weeks, on average 6 new cases per week. 70% of our cases are travel-related, and the median age is 28, with 70% of our cases less than 39 years of age. At a population level, immunization is our best protection against COVID-19. Within the last week, we surpassed an important milestone when over 50% of the eligible population was vaccinated. As of Saturday, May 29th, a total of 93,346 doses have been administered, including 13,441 second doses. So that means 56.8% of our eligible population has received at least 1 dose of COVID-19 vaccine, and 9.6% have received 2 doses. The first dose uptake is high for P.E.I. residents age 80 years of age and over. It's 96%. And for those aged 70 to 79, the first dose uptake is 93%. And 60 to 69-year-old age group, first dose uptake is 88%. The focus of our vaccine program continues to be to protect as many people as possible, as quickly as possible. Our primary goal is for 80% of eligible island residents to receive 2 doses of vaccine by the fall, and for those who are in high-risk groups to be fully vaccinated with 2 doses as quickly as possible. All island residents aged 12 and over can book a vaccine appointment at one of the public immunization clinics. Now it's really everyone's turn to get immunized, so please do your part and book your appointment. And thank you to all island residents who've already been vaccinated or have their appointments booked. It's important that everyone receive 2 doses to ensure they have the sustained protection for COVID-19, especially the variants of concern. The Moderna vaccine is now available at partner pharmacies across P.E.I. for individuals age 18 and over, and you can go to the P.E.I. COVID webpage and click on partner pharmacies to book an appointment at a pharmacy closest to you. Over 4,300 doses of Moderna have been administered at pharmacies in the past 2 weeks. Pharmacies are only offering first doses of Moderna at this time. As vaccine supply increases, second doses will be offered between 8 and 12 weeks, and that's both at pharmacy and at the public clinics. And that's why people who are first vaccinated in late June will be able to be fully vaccinated by September. Starting this week, public health nursing will be offering Pfizer vaccine to youth aged 12 to 15 in junior high to increase accessibility for this age group. Vaccination at school will occur only with prior parental consent. Parents can opt to schedule an appointment for their child at one of the public clinics if they choose, For example, some youth aged 12 to 15 are not in junior high schools, and their option is also to be immunized at a public clinic. There are a couple of options for people who've already been vaccinated to get a copy of their vaccine record. First, in a few weeks, a self-service access to vaccine records will be available through a secure portal on the Government of P.E.I. website. Secondly, beginning on Thursday, June 3rd, individuals can call the vaccine booking line to request a copy of their vaccine record. You can request your record electronically or to receive a paper copy by mail. The number for the vaccine booking line is 1-844-975-3303. Individuals can also request a copy of their vaccine record, either hard copy or electronic copy, at the vaccine clinic when they are being immunized. It is expected that the National Advisory Committee on Immunization will release recommendations today regarding the options for second doses for people who have received Astrazeneca. P.E.I. has administered approximately 5,200 doses of AstraZeneca Covishield vaccine. 2 doses of vaccine are needed to be considered fully vaccinated, and typically the same vaccine is used for both doses. And certainly pending NACI confirmation, P.E.I. plans to give people who received AstraZeneca 2 options for their second dose. They can choose to have AstraZeneca for their second dose, or they can opt to have an mRNA vaccine, either Pfizer or Moderna, as their second dose. People who received AstraZeneca in a pharmacy will be contacted regarding their second dose appointment. And based on vaccine supply, everyone who received AstraZeneca will receive their second dose between 8 and 12 weeks. An important consideration in protecting the residents who live in long-term and community care is the vaccine status of staff members. The staff in these facilities work with people who are vulnerable to severe outcomes from COVID-19. The vaccine uptake among long-term care residents has been excellent, with 91% fully vaccinated with 2 doses. And our objective was to achieve a coverage of at least 85%. In some long-term care and community care facilities, the rate of immunization among staff has been less than our standard of 85%. Our office is working with Health P.E.I. and private owners and operators to improve the immunization rate of staff in some homes. Effective immediately, unvaccinated staff who work in a facility where less than 85% of staff are immunized will be required to be tested at least weekly. It is the responsibility of owners and operators of these public and private facilities to ensure that unvaccinated staff are tested regularly. For the time being, the request for unvaccinated staff in homes with low staff vaccine rates to be tested regularly is a directive. However, if necessary, we will put it in a public health order. Our priority will continue to be keeping the residents and staff in our long-term care and community care facilities safe from COVID-19. Last week, our provincial reopening plan was released. COVID-19 and P.E.I. moving forward. This document is a 5-step plan or a blueprint that will guide us through the last months of this global pandemic. The measures in the plan are based on the best available evidence and ongoing risk assessment. Steps in the plan are subject to change as new evidence becomes available. The plan is based on certain planning assumptions, and I know we mentioned them last week and I'll mention them again. Vaccines are effective in preventing moderate to severe outcomes, and breakthrough infections may still occur. 1 dose plus 21 days of an approved vaccine offers good protection, but 2 doses provides optimal protection. Asymptomatic transmission decreases with vaccination. Herd protection will be achieved when 80% of our eligible population is fully vaccinated, although we will get some degree of protection provided with 1 dose. Vaccines are an additional layer of protection to other public health measures, and the final assumption is that there will be a good uptake of vaccine in P.E.I., and that certainly has been the case to date. P.E.I.'s plan is based on a couple of key factors. The level of disease is low, and transmission of COVID-19 is controlled in P.E.I., the Atlantic provinces, and Canada. And also, based on our vaccine status of islanders. Moving through the 5 steps in easing travel measures is contingent on meeting vaccine targets. For example, when 80% of all eligible island residents have received at least 1 dose, and 80% of those most at risk of severe outcomes, such as long-term care and community care residents and staff, they've received 2 doses of vaccine, we will be able to ease travel restrictions within Atlantic Canada, which is projected for June 27th. And when 50% of eligible islanders receive their 2nd dose of vaccine, there would be increased travel within Canada, again with travel streams. Some have asked why vaccine targets are such an important part of our plan. And I know they're part of really plans right across the country. We know that transmission of COVID-19 is decreased when individuals are vaccinated. Immunized people are less likely to get seriously ill and require hospitalization, including intensive care. Some have asked why P.E.I's plan is different from plans in other jurisdictions. Our moving forward plan reflects the focus of our provincial pandemic response from the outset, protecting the health of island residents by keeping COVID-19 out of P.E.I and working hard to contain transmission when we've had cases. Our moving forward plan recognizes our capacity to continue to focus on those important principles. For example, our reopening plan includes universal testing at points of entry effective June 27th, meaning everyone who enters the province will be tested. This will allow us to identify cases of COVID-19 early and take necessary steps to contain transmission. Also, our plan provides for a slow and measured reopening, first easing travel measures to allow increased travel within Atlantic Canada without travel streams before increased domestic travel with travel streams and pre-travel approval. In terms of testing at points of entry, on May 25th, testing was established at Wood Islands. Effective May 31st, testing was instituted at the Charlottetown Airport. Effective June 3rd, testing will be available for workers on a 24/7 basis at the Dickey Road testing site in Borden. And effective June 27th, the enhanced testing capacity will be available 24/7 at Borden. I'd like to provide some additional information regarding the moving forward plan. Effective June 6th, personal gatherings of up to 20 people in total are permitted. And this is not the limit of your household plus 20, but a gathering of 20 people. Again, on June 6th, up to 150 people in cohorts are permitted at weddings and funerals, and this increases to 200 on July 18th, subject to physical distancing between people of different households. And this limit includes weddings and funeral receptions. And I know we've had a lot of questions about this for many months, about wedding dances. And I like to dance. I know many people want to have wedding dances. And we are working on updated guidance so that we are hopeful that we can have wedding dances proceed this summer. And that updated guidance should be available before the end of the week. The plan references as well shortened self-isolation requirements, effective on June 27th. All travelers who come to P.E.I and must self-isolate will be required to isolate for a period of 8 days, subject to a negative test on day 8. Effective June 27th, the shortened self-isolation period applies to people coming to P.E.I from within Atlantic Canada who are not vaccinated, and work isolators and all other travelers approved to come to P.E.I from outside Atlantic Canada, regardless of their vaccine record. Self-isolation for positive cases and all close contacts will continue to be 14 days. After June 27th, in order to be exempt from self-isolation in P.E.I, people from Atlantic provinces need to have at least 1 dose of vaccine plus 21 days to allow their immune response really to develop. Currently, there is no vaccine approved for children under the age of 12. Children whose parents are vaccinated will not be required to self-isolate. Effective June 27th, people traveling to P.E.I from outside Atlantic Canada will no longer be required to have a 72-hour pre-arrival test. Instead, all individuals will be tested as they enter the province. As a point of clarification, effective August 8th, everyone outside the Atlantic provinces will continue to require pre-travel approval under the existing travel streams: compassionate, family connections, court appearance, work, co-parenting, permanent relocation, seasonal property owners, and students. In addition, all fully vaccinated individuals who enter the province from outside Atlantic Canada under one of these streams will not be required to isolate subject to testing. Partially vaccinated or unvaccinated individuals traveling under the streams will be required to isolate for 8 days. Like other provinces, we are both excited and nervous about the prospect of reopening to travel and easing public health measures over the coming months. I think we said it last week. For some, this won't be fast enough, and for others, it will be too fast. But we are both excited and nervous about it, and we will go faster if we can. The thought of transitioning out of a public health state of emergency is hopeful, it is doable, and almost surreal. We are all looking forward to the time when we can travel more freely and host family and friends without restrictions. The moving forward plan is a sign that we are well on our way to easing back to being able to do these and other activities that are near and dear to us. The plan allows us more time to get island residents vaccinated with 2 doses. I encourage all eligible islanders who have not yet made their vaccine appointment to please do so. Do it to protect yourself and your loved ones. Do it so our children can continue to attend school and activities. Do it so we can attend concerts, have family celebrations, and enjoy sporting events as participants and spectators. And do it for P.E.I. COVID-19 is still with us, and there is, of course, the threat of a 4th wave being discussed nationally as well. Our best defense is a good offense: to get vaccinated, to avoid taking unnecessary risks, to follow the rules and respect the public health measures until we can get to that point of really feeling that we've achieved herd protection. As we continue to care and support each other through this global pandemic, let us continue to be patient and let us continue to be kind. Thank you. And Marin's not here today, so I'll open it up to questions.
Dave Stewart, The Guardian.
Good afternoon, Dr. Morrison. Thanks for taking our questions as usual. I wondered if you could give us an update on the situation with Leaps and Bounds Child Care Center. Things got tied up last week with the reopening plan. I'm just wondering, has everyone tested negative, and have any charges been laid?
Hi, Dave. So thank you for the question. And you're right, it was, it got, we didn't end up talking about it on Thursday. And I am very pleased that besides the 7 cases involved as amongst adults, there were no further spread amongst to any of the children at the daycare, and all 3 tests have been completed. And in terms of the charges, I know that the information was referred to enforcement, and I think the enforcement updates are now available online on a weekly basis. So that should be online at this point in time. I think I may have the information here. But if not, I think there have been 177 charges with 8 pending. The last numbers I have, but again, those should be updated online as well.
Okay, thank you very much. I guess my follow-up question would be in relation to the August 8th date. It kind of looms quite a bit for seasonal residents in the United States, especially. It's a week before Old Home Week starts. We have an awful lot of island natives that work in the U.S., that raise horses in the U.S. A couple of them I've been talking to. I'm wondering, are there any avenues for them to be able to come home for Old Home Week? What are the rules? How does the August 8th plan fit for them? Or is there an option?
Well, certainly when the federal border opens to, and that's a decision, of course, that's not ours to make, but if you are a seasonal resident in the U.S., for instance, when the federal border opens, you would make the application through the seasonal resident stream, just like other seasonal residents from this country, and then apply for travel approval. And if you arrive before, if the border opens federally before August 8th, they would be able to apply before that and have their isolation period here, like other domestic seasonal residents, for instance, and subject to the testing as well. So it really is dependent on that federal border, but they would come in as family connections or seasonals, or work under one of those streams once the border opens.
That's great. Thanks very much.
You're welcome.
Hi, it's Laura Meader with CBC.
Hi, Laura.
Hi, I was just looking for some more information regarding the vaccination issue with workers in long-term care homes and community care homes. Is it fair to say there's been a hesitancy among workers? Can you describe more what the issue is there?
Hi, Laura. So it's, I think it's important to clarify that the majority of the long-term care and community care facilities have not only high rates of vaccine uptake for residents and staff, but there are a handful of long-term care and community care facilities where the rate for the staff is certainly less than 85%. So so we are concerned about those few homes in particular, and then it's made us look at, we know that outbreaks in long-term care facilities have been an issue throughout this pandemic, and we think if some of these staff are not vaccinated, testing will be an important component for them, especially in the next few weeks as we go forward. So we're working with the homes to try to have those rates increased. I think some of it may be some initial hesitancy amongst certain staff. We know some staff have their appointments booked, which is great. And so we've been really working with a lot of the administrators to try to increase those rates to above 85%. So, and the majority of them have, but there certainly are probably a half a dozen that we're concerned about.
Okay. And I also wanted to ask about the Astrazeneca vaccine. You talked about a couple of options for people who have already received that first dose of Astrazeneca. What do you want people to know who are waiting for that information on what their next steps should be?
Well, Laura, I think we mentioned it. I think it's that if you've had AstraZeneca as your first dose, that there are you will be contacted through the pharmacy so that you're aware of the options for your second dose, but that there will be information about effectiveness and safety of both having a second dose of mRNA or a second dose as AstraZeneca, and looking at effectiveness and safety of both options. And I think the other thing to know is that you'll get your second dose at an interval that's either 8 to 12 weeks after your first. So for some, that will mean they'll be able to get their second dose of either the mRNA or AstraZeneca next week, starting next week. So I think we've been waiting for a while for some information, and this is what we certainly anticipated, and this will be, I think, confirmed with the NACI statement that's coming out this afternoon.
All right, thanks very much.
Okay.
Louise Martin, CBC.
Hi, Dr. Morrison. Hope you had a nice weekend. So my question is around the border and what that's going to look like. We know that the new rapid testing parking lot is being constructed, 18 lanes. How will that work exactly? When you pull up, how long does it take to get a rapid test result back? And if you do test positive, will you be turned around at the border? What is the process after that?
Hi, Louise. So a couple of things. One, we already have screening at the point of entry. So we actually are having a number of people who are screeners, also making sure they have training so that they can may also be involved in the testing or running one of the ID Now machines, the molecular machines that are going to be used for testing. They've been timing the process to try to make it as seamless and efficient as possible, and they've calculated how many vehicles may be anticipated per hour at peak times so that they know how many lanes will be required. And the information, I think certainly the plan is, as far as I understand it, is you'll have a phone number for the individual. If you pull up, you get screened, you have test, you have a phone number. The result will be available, let's say, within 20, 30 minutes, if all goes well, and then it'll be, the result will be available, or you will be called. If it is positive, you will be asked to proceed to a confirmatory test at one of the testing clinics, and that's a PCR-based test. So that's what happens now at the testing clinic, for instance, at Borden now for workers. If there's a test that comes back positive, we get a hold of them, and they proceed on for a confirmatory test, and they do isolate until that confirmatory test comes back. And I think it's one more layer. We've talked about the fact that we were able to do some of this by having an extra layer of protection for island residents, and we can hopefully pick up any COVID earlier than we would have in another way.
Okay, in my mind, I was trying to picture, you're not sort of sitting there waiting for the test results, then you're being contacted.
Exactly, so you'll continue to drive down the road.
Okay, perfect. Thanks for clearing that up. And there has been a lot of confusion. You addressed this a little bit in the briefing today with the reopening plans and sort of no consistency amongst the provinces in Atlantic Canada. It really is essentially no bubble, but each plan is different depending on the province. Can you just clarify the rules for islanders that might want to visit New Brunswick when it opens, I believe, June 6th this month? Do they have to self-isolate for 14 days when they come back? I think there's some confusion that people think because New Brunswick border's opening that they're free to come back and forth between P.E.I. and New Brunswick.
Well, Louise, I know the premiers would, and I know I share this with the other health officers too, and ideally it would be all the same day for all of our provinces, but we're in slightly different positions for various reasons in terms of hospitalizations, outbreaks in each of our respective Atlantic provinces. But until June 27th, if an islander decides to go to New Brunswick on June the 10th, for instance, and they come back, they will isolate for that 14 days. But if it's after June 27th, if they're vaccinated, they and with at least one dose, then when they come back after June 27th, they would not need to isolate. Does that help?
I appreciate the clarification. Thanks very much.
Okay.
Marine Orno, la voix.
Good morning, Dr. Morrison. J'ai une question par rapport au vaccin. Est-ce que les gens qui ont une première dose d'Astrazeneca et qui en seconde dose auront du Pfizer ou du Moderna seront aussi bien protégés que s'ils avaient eu 2 doses d'Astrazeneca?
Bonjour, merci pour la question. Alors, c'est vraiment partie de l'information qui va être donnée. Alors, si vous aurez le choix vraiment, si vous avez AstraZeneca pour première dose et vous pouvez choisir AstraZeneca pour deuxième dose ou Pfizer, Moderna. Et puis, si vous recevez une deuxième dose de AstraZeneca, c'est à peu près 60 à 80% effective à réduire les complications qui sont associées avec COVID-19, qui arrivent à peu près commençant 14 jours après la deuxième dose. Et puis, si vous recevez un mRNA vaccin, ils ont pas toute l'évidence, mais il y a peut-être, c'est difficile à dire pour certains, mais avec une étude de l'Espagne, il dit que c'est peut-être un peu plus effectif avec une dose de mRNA. Mais et puis c'est possible qu'avoir deux vaccins différents peut stimuler le système immune system en façon un peu plus différente et puis peut-être vous protéger un peu mieux, mais pas toute l'évidence n'est pas encore reçue encore, mais alors c'est pourquoi vraiment vous êtes donné les choix.
OK. Merci beaucoup. Bon après-midi.
Bon après-midi.
Gabrielle Trumeau, Radio-Canada.
Bonjour, Dr. Morrison. Alors, ma question va dans le même sens. Alors, vous avez dit que le Comité national de l'immunisation devra offrir deux options par rapport à la deuxième dose, soit avoir une deuxième dose d'AstraZeneca ou une dose de Moderna ou de Pfizer. Alors, vous, quelle option vous recommandez aux gens? Alors, quelle sera la recommandation de la santé publique par rapport à l'administration de la deuxième dose?
Alors, je vais attendre pour certains de regarder l'information de NACI cet après-midi, mais je pense que c'est vraiment c'est une recommandation d'avoir deux doses de vaccin. Ça, c'est et puis, on veut diminuer le risque d'être malade ou de transmettre le COVID-19. Alors, c'est vraiment de donner aux gens, aux insulaires, dans ce cas, l'information à propos de l'effectiveness, l'effet du vaccin, qu'est-ce qu'on sait à propos des risques, les effets secondaires, et puis donner l'information à propos des deux types de vaccins. Et puis, c'est vraiment, à ce moment, on plan le plan d'en faire ici à l'île Prince-Édouard. Et puis, et c'est important d'avoir le choix des deux vaccins qui sont vraiment approuvés par Santé Canada.
Et en fait, ma question de suivi, c'est par rapport au fait que le vaccin d'AstraZeneca a fait quand même l'objet de beaucoup de controverses ce temps-ci. Est-ce que vous attendez à ce que les gens vont choisir davantage Moderna et Pfizer pour la deuxième dose? Et est-ce qu'il y a assez de vaccins, de ces deux vaccins-là, pour immuniser tous les gens qui ont déjà reçu une dose d'AstraZeneca?
Alors, je ne sais pas si j'ai compris vraiment tout à fait la question, mais on a assez de vaccins Pfizer, Moderna pour en offrir le deuxième dose. J'anticipe que peut-être plus de gens vont en prendre le vaccin Moderna ou Pfizer, mais je sais qu'on va avoir assez pour offrir aux gens s'ils veulent avoir l'AstraZeneca aussi. Je m'excuse si je n'ai pas compris votre question.
Non, c'était exactement ça.
Ok.
Bon, merci beaucoup.
OK, merci.
Stu Neatby, The Guardian.
Hi, good afternoon,
Hi, Steve.
Dr. Morrison. I was just wondering, I guess, about vaccine verification for individuals who are traveling to Prince Edward Island from off island. And I mean, a couple of days ago, the New Brunswick health minister basically stated that in some cases they may use an honor system when it comes to verifying vaccine status. So I'm wondering, when it comes to P.E.I, what forms of verification will be accepted, both in print, electronic, and how will it be verified that they're correct?
Hi, Stu. So actually, we even had a meeting about that issue earlier today. And so I think it's we're definitely working on what we're going to be asking for, but also what is logistically possible as well. So as we mentioned last week, there's for those traveling in Atlantic Canada, for instance, there is a declaration form, and part of the discussion is whether we would have someone upload the vaccine record, and it may look different in different provinces, so that can be looked at prior to getting to the point of entry, because we certainly don't want to slow things down at the bridge, for instance. And the same kind of request to people who are applying for pre-travel approval, that may be a piece of information that we're looking for as well. So it's a vaccine record. We've had lots of questions about vaccine passports, vaccine records, and I think there is a distinction. We are certainly not recommending vaccine passports or records to be used to attend certain events in Prince Edward Island or to participate in certain activities. It is something, vaccine records would be something that we would be requesting just in the interim, so that we can make sure that we keep or get as many islanders fully protected as possible and minimize the risk of spread of illness into the province and or of those coming in, and also minimizing the number of people who will get sick if they do get COVID. So anyway, that wasn't, I went off a little bit on your question there, Stu, but so those details, of course, are being finalized, but it will certainly recognizing that the vaccine records in our provinces don't look exactly the same, but there are, one part would be to make sure that the vaccines are one of the approved vaccines for use in this country, and at this point, that's what we would be looking for.
Okay. Well, thank you for that. I'm wondering, I guess, what happens on the other end when the data is actually collected. What departments in P.E.I will have access to who's been vaccinated and who hasn't, and will this information be shared with any other province or any other jurisdiction?
Stu, so we had a meeting with the Privacy Commissioner this morning as well. So there would have to be a retention schedule for any of the vaccine records. It would not be shared with other provinces or other departments. It would be through, whether it's through the Office of Public Safety, Chief Public Health Office. Again, we are working on those details, Stu, and we said that last week, and those discussions continue, but it's again, an interim measure until we can try to do what we can to fully protect islanders as best we can. So, and this will be, we know vaccination records will make a difference. Though people who are vaccinated have less chance of getting sick and being admitted to hospital and going to the ICU with COVID. People who are vaccinated have less chance of spreading COVID-19. And so that's why, until we have islanders with 2 doses of vaccine, that's important.
Okay, thank you very much.
Welcome. Okay, thank you very much.